My guest today is Paul Perreault, the former CEO of CSL.
You can be the CEO of, the largest company in the world, but you still shouldn't confuse your job with who you are. And so people looked at me and said, "What are you doing?" They all said I was crazy. There were very few believers. Less than 5 years later, we were more than $1 billion in revenue.
What do you think the value of being a generalist?
So the generalist piece, what I find is that you get a better sense of all the interconnectivity of what happens around you in business or in life. We were growing because we had the benefit of that core business in plasma, growing at double digits every year with thoughtfulness and purpose, right, and insight. That's the way I looked at the business.
My guest today is Paul Perreault, the former CEO of CSL, one of the most important but least talked about companies in global healthcare. Paul led CSL for a decade, growing it into a $130 billion market cap company and the world's leading manufacturer of plasma-derived therapies. Under his watch, CSL significantly expanded its plasma collection network, turned around a flu vaccine business, and brought to market the first approved gene therapy for hemophilia B. What makes this conversation interesting is how Paul thinks about leadership and how he thinks about himself. He grew up the second of 8 kids and went to seminary planning to become a priest, but realized he couldn't be himself within that structure. One lesson that stayed with him his entire career: never confuse your job title with who you are. We talk about why CSL's plasma business forced a level of capital discipline unlike other biotechs, the 3 major acquisitions that defined his tenure, including the one that didn't go as planned, and what it was like to be an American running an iconic Australian company. Paul is direct, but feels strongly that quiet, patient leadership is the most powerful kind. No spotlight needed is proud to welcome Paul Perreault. Well, welcome, Paul. Thank you for being here today.
Stella. Yeah, thank you. It's a pleasure to be here with you.
That's great. I love the picture in the back. What is it?
Yeah, that is up in Mount Moran. So it's up in the Tetons, and that area of the water is called Oxbow Bend. It's a very famous place for photographers to shoot pictures of elk crossing across the river because it gets shallow in that area. And so you get these morning shots with some fog and dew misting in the background, the sun shining through, and the elk crossing the river. It's pretty special.
That's great. It's beautiful. It is absolutely beautiful. I see your book in the background, The Detour CEO, which is a book that you wrote just last year. Can you tell me a little bit about the title of Detour and
Sure.
what detour means to you in your career?
So detour to me just means that, life happens. And so you get faced with challenges and opportunities, and it's really a way of navigating through life. And sometimes where you think you're on a path, and it's leading you in a certain direction, you find out that it may not be the right path. So you take a turn and you detour. It's kind of like if you think of a strategic plan to cross the country from New York to California, and your guardrails in your strategy are southern border and northern border. So you want to stay within the continental US. You have a lot of different roads you can take and still get to the same place. And so for me, the detour was really those opportunities in life in my strategy of service. And I didn't know where it would take me necessarily, but I knew that if I had a snowstorm in Colorado, I could go south to Vegas and then back over to LA. So, those are the detours I'm talking about, is being ready for opportunities if they come your way, or learning that this is really a block for you, that you need to go a different path. And so those are the detours that I thought of when I wrote the book. It's that it's not necessarily like, major necessarily detours, although some were, a big shift from the beginning of my career when I thought I might want to, be a priest, which was turned out, to be spam. The calling was not quite what I thought. So it was a different way of serving, but service was always in my mind. I always felt like I wanted to serve people and, make a difference.
Well, let's go back into that history a little bit. You did join the seminary. It ultimately was not your calling, becoming CEO of a company, a global company was then ended up being your calling. But what did that experience teach you? And what did you carry from the seminary throughout your career?
Well, what I learned is that there's a lot of people that want to do good, and there's different ways of doing good. For me, the structure of the church did not allow me to be an individual. This is back in the 70s, and it was a very, when I say formative, I would more say forming uh, process where they wanted you to be a certain person.
Hmm.
And for me, growing up post Vatican II, the priests were out working more in the community, actually turned the altar around so you could see them. So they were reaching out and trying to be more ecumenical in terms of that process. But the institution of the church didn't necessarily see it that way. So for me, it felt like they were trying to mold me into what they thought a priest should be, as opposed to me being an individual serving as a priest. And so I
Yeah.
didn't feel like I had the opportunity to be who I am. And I'm always who I am.
Yeah.
I'm the same idiot brother I've always been. I still have to take the trash out at night for, at the
Right.
house. I mean, it's like you can be the CEO of, the largest company in the world, but you're still shouldn't confuse your job with who you are.
Yeah. You mentioned your family. Did I read correctly? You were one of 8 kids?
Second oldest to 8 children. Yep.
Second order.
5
What was
boys,
that
3
like?
girls. You always had somebody to fight with. It was great. Taught you a lot about working in a situation where you have a lot of people with different ideas and different needs and wants, and really prepared for a business life of dealing with large organizations and people. I mean, the family unit was large in itself comparatively to a lot of other families that I knew that some of my friends were only childs.
Well, so, let's fast forward a little bit to your career. Um, you actually started as a field rep, a field sales rep,
I
at
did. I
at
thought
a
I'd retire a rep.
yeah, it was a company called A.H. Robbins, which I had actually never heard of, which ultimately became AHP and then got acquired by Wyeth. But you were there for almost 16 years with the same company, and you had a lot of different roles. Um, and so, in that way, even in your book, you talked a little bit about being a generalist, right?
Correct.
Lots of different opportunities, as we talked about earlier. What do you think the value of being a generalist is in general? And maybe even, applying it today, in a role, with AI, um, we've been told up until this point to be specialists, right? To go deep into something. What's the value of being a generalist in your mind?
Well, I think in today's world, the value is really that you have a broad sense of what's happening around you. And that was in the business world as well. My background is a liberal arts background. Being in the seminary for
Psychology.
3.5 years, they didn't have business, majors. They didn't have science majors. And so first I started as a history major and figured out I didn't want to necessarily go teach history. And so I switched to psychology, thinking, well, that can help me with, a lot of understanding of human behavior and working with people. And it's something I can probably use whether I proceed in the seminary or not. But I have a minor in philosophy, a minor in religion, a minor in
Oh,
history,
it's
and,
philosophy.
a degree in psychology. And then I did an additional 38 hours of medical school training at University of
Oh,
Florida, just in terms
huh,
of boning up on things like anatomy, physiology, medical terminology, biochemistry, because I didn't have that background. But I was constantly on this learning mode, which helped my generalist view.
yeah,
So the generalist piece, what I find is that you get a better sense of all the interconnectivity of what happens around you in business or in life. I wouldn't say I'm shallow, but I do know,
maybe
I
not the
do,
best word.
I do know a little bit about a lot of things, not a whole lot about anything in particular. Right. So
Right.
it's one of those things where the generalist in me, and a number of years ago, Harvard Business Review was doing a review of the success of CEOs, and the article pinpointed that one of the major reasons that CEOs did not last more than a few years, and this is now going back into the 90s, and early 2000s was that they were one-dimensional. So in our industry, for instance, they might be a scientist that created a new product and became the CEO, but didn't understand the manufacturing, didn't understand sales and marketing, didn't understand, the distribution, didn't understand those. So they were relying on other people for that information. And I did at Wharton, there's a specialized MBA program sponsored by the company that I was with at the time. And we broke up into groups. And so I tried to get away from the commercial people because a lot of my background early on was in commercial.
Right.
And so we built a team that had operations, it had finance, it had commercial, it had manufacturing. And the whole point of the exercise, the simulation that they put us through, was your team had to every day do work on the company to build value. And at the end of the day, the professors would look at it and write the headlines in the newspaper and adjust your share price. Well, a lot of people migrated to themselves. So you had a bunch of engineers working together, or finance people, or commercial people, but they forgot about all the other pieces. Our team was very diverse in terms of knowledge. And so we said, well, wait a minute, that's great, you got to sell all this stuff, but we also have to make it. So how are we going to allocate the capital that they've given us into all of these different areas where other people were like building, but forgot that you're going to have to sell it, or they were, so worried about the marketing piece, they forgot they had to make it. But for me, the generalist, and even with AI, you have to be able to have a capacity to learn new things if you want to survive in today's world. So the ability to take on new opportunities, learn new skills was always what drove me, and it became my generalist theme.
Well, I love it. And I think that I think we spent way too many decades becoming specialists, and now we get to, as you said, be shallow. Get to be a little shallow.
But you do need those specialists too, right? I mean,
Yes,
so
of course.
it's this, combination. Not everybody can, just be a generalist. You
That's
do
right.
need, domain expertise in certain areas to really drive the things that you need. So I'm not saying you shouldn't be a specialist, because we need those specialists. But for me and my career path, the generalist route seemed to work pretty well.
There you go. Well, good. Um, I'm curious, going back to family for a second. Your dad was actually working at the same company that you did. He was a regional sales trainer. What did you learn from him?
Well, certainly hard work, but it was what I learned is, he was dedicated to making sure he knew everything about all of his customers. He took copious notes
Mm.
after every call. I saw him, talk to people that he seemed to know forever because he knew
Yeah.
everybody's name. He was able to really build relationships, strong relationships. And what I learned is that he loved his job. He loved what he did. And so that's also helpful, right? Because we work a lot of hours, and to do something that you don't enjoy is what I would say is crazy. There's other things to do that can find the joy in life.
And I mentioned that you were at Wyeth for 16 years, and then you took a leap to a small company called Centeon, which we'll get to in a second. But I'm curious, when you think about when is the right time to leave, what advice do you have to others when they've been somewhere for a long time? You got exposure to lots of different things. I'm sure you were kind of going up the ranks. What advice do you have to others when it's the right signal that maybe you should take a shot on something else?
Well, for me, it was not being complacent, because I felt like I could do more. So some people get frustrated by that. They say, okay, I can do more, and they're not letting me. Well, who's not letting you? What are you
Right.
doing to make that happen yourself? And for me, I was at a high level. We had changed the company at Wyeth into business units, and I was running one of the 22 business units in the country. So I would progress very well. But I didn't feel like I was really adding much value. I mean, we had a large sales team. You could talk about the marketing plan for that month. You could do some hires and get the right people. But I felt like the process within the company was bogged down. I mean, I could see business opportunities, but then it would have to go into contracts and would sit there for 2 or 3 months while people reviewed everything. In the meantime, the competition was eating our lunch. when I heard there was really no plan, it was just kind of keep doing what you're doing and we'll figure it out. I'm like, I need to see if there's anything else out there that I can do.
Yeah.
So that was really the impetus. I mean, I was doing fine. I could have stayed there. I could have done the job. I might have been promoted, but Wyatt ended up getting bought by Pfizer. So you don't know whether that would
Right.
have happened or not. So I think those triggers, people don't be complacent. It's kind of like companies that become complacent, right?
Yeah.
They see they're in a big growth curve, but they forget to kind of look back and say, where are we on that curve? Because once you get to the top and you start going over the peak, it's all downhill.
Yeah. No, I know. It's like the classic innovator's dilemma, right? Which is you get a little complacent. So you did make that leap to a company at the time, a small company called Centeon, which ultimately, became what later became CSL. But this was a plasma-based drug company, right? You had to collect plasma, which is, from patient blood, and then drugs were created from it. I think actually, as I did research on CSL, I think one of the things I did not appreciate was how different of a business it is from a traditional biotech or pharma company. Can you talk to us a little bit about why CSL was so different and what makes, it I don't want to say a more complex business, but in many ways it is a bit more complex.
Well, it is more complex because the supply chain on plasma is difficult. Probably the hardest thing we did in the business is collecting plasma.
Yeah.
And still today, that's the case because you have donors that you're trying to attract to come in. It's not like a dialysis center where the patients have to come in. The
Right.
donors have the opportunity to come in if they want, but you can't make them come in, right?
Yeah.
So you have this whole idea of the donors coming through, and these are busy centers. I mean, the largest centers we had might have 5,000 donors a week coming
Oh
through
my
the door.
gosh.
So you
Wow.
have the masses of humanity coming in where you're doing a medical, highly regulated procedure to collect plasma, return the red cells to the donor, and then keep the plasma, which has to be then sampled, tested, frozen, shipped, and held for at least 60 days. Because if the donor doesn't come back, you can't use that plasma because they could have seroconverted to a virus between the first donation and the second donation. So we
Oh,
needed
I didn't
at
realize
least
that.
2 donations from every donor, right? It's not like whole blood. You give whole blood, it goes out. They do some testing, but we were the largest collectors of plasma in the world. We were collecting over 20 million liters of plasma a year when I was there. Um, and out of the 30 plus thousand employees that we had, about 15,000 or so were doing nothing but collecting plasma every day.
Wow.
So it's a massive operation, hundreds
Yeah.
of plasma centers around the country and
Yeah.
also in Germany. And um, uh, it's just, it was a different thing. And it's expensive because
Yeah.
it takes over 200 days from the time you collect plasma till you see the product on the market. So the lead times are significant.
Seeing huge. Yeah.
So, you can't just start it up and collect it and then say, okay, we're going to shut it down, because as soon as you shut a center down, the donors don't come back because you're trying to get them into a habit. So it's an interesting dynamic. So the cost of material and manufacturing was about 65% or so of our total costs, where in
Wow.
pharma, 65% of their costs are R&D and marketing, right?
Mhm.
So I couldn't just lay off a big number of people to save money, which meant we had to be extremely thoughtful about
Right.
all of our investments and what we did and what we spent and the expenses that we had and the budgets that were held to. And that's the big difference in the economic proposition between pharma biotech and a heavily dependent plasma business.
I'd love to talk about some of that, the strategy at CSL after you became the CEO. You clearly worked your way. You had, as you be, perfected your generalist strategy by doing operations and other aspects. You did become CEO in 2013. And you were CEO for 10 years, which is really incredible. And during that period of time, CSL saw a scale up of its core operations, a real acceleration, which I wanted to ask you about. And several different acquisitions, which I also want to ask you about. So let's talk about first on the scale up. I think, and I don't have the numbers right, but maybe you were doing single digit to double digit increase in number of plasma centers per year before you became CEO. And then after you became CEO, maybe you doubled or tripled uh, that growth of the plasma centers. Can you talk about why? What was it about the business that made you, when you came in, to say, on my watch, we're really going to accelerate this business?
The demand was always there. That's the issue, is that, I worked when I started in the company, I was at Centeon, which is precursor. There were shortages of a product called immune globulin, which is
Mhm.
IVIG or subcutaneous immunoglobulin. So the protein that protects us from infection. So if you think of the worst patient in the world, it's what's called SCID, or severe combined immune deficiency, also known as boy in the bubble disease,
Yeah.
where kids have no immune system. But there are about 100 different types of immunodeficiencies that people have, and they live with this for years because they get sick. Then they go to the ER because, your doctor says, well, if it's an emergency, you go to the ER. So you have a sinus infection. You get an antibiotic. 4 months later, you get an ear infection. And so again, you either go to the doctor, the ER, maybe not the same caretaker, you get an antibiotic. They're treating the symptoms. But if you have more than 4 or 5 infections a year, that's a sign that there could be an underlying immune problem. And people live with this. They just don't feel good most of the time. And that's called common variable immune deficiency, which by definition is more common.
Yeah.
And so it's one of those things where I could see the demand. I worked with patient organizations in the day, and I would talk to the patients, and I would talk to the physicians, and we would do grassroots work to actually get better diagnosis. You know,
Hmm.
when physicians hear hoofbeats and they're trained, they're looking for horses. What we're looking for is zebras. These are people that are different than the mainstream. You have to really dig in and understand. And if you're going from doctor to doctor, prescription to prescription, nobody's taking time to really understand that there's something else going on with the patient.
Yeah.
So I could see the demand. The demand was always there. The problem was there wasn't enough product. And so the only way for us to build for the future was to start now to expand those plasma centers. Because as I mentioned earlier, 200 days from the time you collect until you see product on the market. So it's going to take you a year to a year and a half to get a plasma center up to profitability and running at a pace that actually can deliver product for you. So we started looking at our capital allocation and said, okay, how many centers can we open this year? Where's the right place to open them? We had a whole design as to the right place on, bus routes where people could get to the centers, on college towns where you had young, healthy donors that, needed extra money, in this gig economy.
Yeah. Right.
So it's one of those things where you had to really have a process and a strategy around what you were going to build and for how much. And my competitors weren't doing that because it's not cheap to do this, right? So I was investing for the future of the business because I could see the demand, and my competitors didn't want to spend the money, or they thought it was going to be too much plasma. But to oversupply the market would be very, very difficult in today's environment because
Even
the
today.
demand just went straight up. I mean, we were growing at double digits every year. This was our
Yeah.
core product. The only reason we collected product was for immune globulin. All the other products came with it because in plasma, you have multiple proteins for different diseases. So you had multiple products coming out of this liter of plasma that you were trying to manage. But I knew that the demand for IG was going to continue to be there, and that was the key driver force for the company. And
Yeah.
so from a profitability perspective, from a patient need perspective, that's why I was doing it. And the competition wasn't keeping up. And I said, you know what? I'm happy to take it. There are certain things that you can do in that business because of the complexity. You clearly have to differentiate your product, right? You have to innovate. So we innovated in terms of delivery from just IV to subcutaneous, having the ability to step in when other people stumble in our industry, because it is a bit of an oligopathy. There's not that many people that do what we did. right? And so, and there were problems with manufacturing or plasma collection, and we were able to step in and take advantage of that, right? And
So
you
it does,
have to be as efficient as possible. So you have to be the
yeah.
most efficient. So innovation, efficiency, differentiation, and the ability to step in when other people stumble. Those were the four key things that really helped us.
You talked about the capital allocation decision. As you talked about opening up plasma centers, very capital intensive, a high operating expense ratio, if you will. And so you didn't have, I'm going to say this, as much money sloshing around as perhaps some other, companies your size did. So, in that sense, you had to be much more judicious
Yes.
with your capital allocation decisions. Maybe on that, you also increased R&D at that time too. So you're expanding all your plasma centers, but you actually increased R&D from kind of a mid to high single digit rate to a low double digit rate over that period of time. Was that also very strategic in saying, now we have the supply, we can go out and develop new products?
Well, it is about innovation, as I mentioned. That was the piece. I mean, in our business, if you're not innovating, you're managing your exit. You have to continue to go, and
Yeah.
R&D is the driver of the innovation that you're going to see. Just living off of what you have is, okay if you're living a short life, maybe, but in a long life situation where your strategy, you're trying to look out literally a decade, because your R&D projects take 8 to 10 years to come to fruition when you start. So
Yeah.
if you're starting from scratch, it could take you that long before you actually see the benefit of that product portfolio. So you have to start early. The other thing is that we were very judicious with R&D on understanding and having insight into what we were investing in. But
Yeah.
it takes time and patience and understanding and insight into these things.
Yeah.
You don't do it overnight.
So that's a perfect segue, actually, to talking about the first major acquisition that you did as a CEO, which was the acquisition of Novartis's vaccine business. At the time, people I think shareholders were questioning it, saying, "Why are you investing in a vaccine business that I think was losing money at the time? It's not a growth business." What value did you see in buying that business? And you were actually able to make it very successful. But can you walk us through the rationale and what was so attractive about what ultimately became CSL Seqirus?
Sure. So it wasn't all of Novartis's vaccines. It was specifically their flu vaccine business. So again, I'll hone in a little bit on some specialization as opposed to generalization. They had sold their vaccine business to GSK, and GSK was reverting with their consumer portfolio. Flu was the one outlier because, from an FTC perspective, GSK and Novartis were the two largest flu vaccine players at the time, and that would then cause a monopoly, really, in the influenza vaccine space. So there was a request that for this acquisition of the vaccines and the transfer of the consumer, that flu was divested. So at the time, now we're in 2015, there weren't a lot of people buying flu. And we used to do the reassortance of all of the strains. But when you separated flu out and said, okay, you stand on your own 2 feet, we weren't making, it was in the red.
Yeah.
So we had some very smart people that worked on that and turned it around, and we got it into the black. And we knew the levers to push and pull with influenza to do that.
That's good.
Because it was such an interesting part of Novartis that there was a new facility for cell culture flu vaccine that was built in North Carolina. But it was really a lot of other, I would say, programs that were being done in BARDA that were being done in the North Carolina facility besides just flu-based or cell-based flu vaccine. But it looked like a great opportunity to me because I knew that there was really going to be no other buyers, because I looked at selling our business because it was subscale. right? We were
Right.
mainly in the Southern Hemisphere. And so I said, I either need to double down or we need to get out. Nobody's buying, so let's see what we can do to make this deal work. And there were some restrictions on private equity and other people that didn't understand flu coming into the process because of the investments that BARDA had made, right? They didn't want somebody coming in and not understanding what they were trying to accomplish.
Yeah.
And so I bid, and it was, I thought, a very, very good deal.
Yeah.
And we acquired the North Carolina facility. We acquired their egg facility in Liverpool in the UK. We got their R&D facilities in Siena. We got their product portfolio, and it made us a scaled player overnight in terms of influenza. Now, we had to invest a lot because it was a carve out of a carve out. We had no infrastructure for that business. So we had to build the IT systems, and we had to build the finance integrations, and we had to do all of that ourselves. And so people looked at me and said, "What are you doing? You know, nobody's getting into flu." You know, the investors were not happy because I said, we're going to invest this money because, and that's why, you know, your profit numbers that you had in your models don't look the same as you thought they would this year. But I said, give us time. I said, within 5 years, we're going to have $1 billion in revenue and double-digit EBITDA growth approaching 20%. And they all said I was crazy. And there were very few believers. Less than 5 years later, we were more than $1 billion in revenue and more than 20% EBITDA. And so, and then everybody said, "Well, we knew that, but we knew that." I said, "Well, I remember the conversations differently, you know."
Of course.
But it's
We were
because
always smart
but it's
after
because
the
we
fact.
deeply understood flu. We knew
That's right.
it was in our core competency, it was in our core capabilities, it was in our core adjacencies, and we had people with insight in the business. So that was the whole process that we went through with the team, and we talked about, and I convinced the board at the time that we should do it. This was a good deal.
Yeah. It definitely turned out to be. I want to ask about your next deal in 2020, which is called Unicure. And this was gene therapy for hemophilia B. $450 million. It was still in phase 3 when you acquired it. And it ultimately became, when approved, the most expensive drug therapy on the market at $3.5 million per treatment. Is gene therapy not a shiny object that you were chasing in that instance?
So I did an interview in 2013 when I came into the role, and I had 3 commentators that had a radio show that they were asking me in Australia. They said, "Why aren't you in gene therapy? Why aren't you in gene therapy?" So this is 2013, right?
Yeah.
And I said, "Gents, if you could tell me who the winner is going to be, you know, tell me about it. But I've got plenty of other things I have to get done first. You know, we have to do this, we have to do this. I have to continue on the strategy that was, you know, set with the former CEO and myself. We all worked on it together. So it wasn't like when I came in 2013 that I just upended everything that was being done. It was all part of a strategy that we had developed because it was a long-term strategy. So execution was key, you know, commercialization and really spreading the global footprint for our commercial business. And you talked about my investment in R&D. It was R&D, commercial, and plasma. Those were the 3 investments that were key for us. We had to keep up with manufacturing. That came along with more plasma. But the gene therapy piece, you know, gene therapy was set back 20 years back in the early 2000s when some people died from gene therapy, kids. And we were told that hemophilia would be cured with gene therapy by 2005, right? And now this is 2013. So it was one of those things where I said, I'm not going to just jump into gene therapy without knowing more about the landscape, who's going to win, who's going to lose. And so we started doing research, and, you know, this was going on all the time before the Unicure deal. But we saw an opportunity again with Unicure where the factor 9 hemophilia B, because everybody's going after hemophilia A. That's the larger market. There's more hemophilia A patients, almost 3 times as many as hemophilia B, right? But hemophilia B patients need help too because they bleed as well. It's factor 9, not factor 8. And so there were liver toxicity problems with some of the other products. And because Unicure was working on factor IX, and factor IX is actually made in the liver, there were some benefits to approaching heme B. And these were patients that we've known and taken care of we were the leaders in factor IX recombinant therapies.
Mm-hmm.
So we already had the market share leader in hemophilia B. This didn't have a lot of the other issues in terms of toxicity that the A products were running into that they've since solved. And we saw this as an opportunity to cure patients. And people say pharma companies don't want to cure anybody. I can tell you there's a lot of money in a cure. And it's not just because, the price was high for sure, but you have to understand these people are on the other products for life. And they're not cheap. And if they have an accident and they're bleeding, they could use $1 million of product in a year.
Yeah.
And then they're still on it for another 20, 30, 40 years. So, on the average, it was about $500,000 a year in therapy for these patients. And so I know $1 million, $3 million, $3.5 million,
yeah.
$2 million, depending on the country and the reimbursement, but it's millions of dollars. But it's a cure for many of these patients.
Yeah.
So it's one of those things where, okay, you do the economics, and we did all of the pharmacoeconomics, and we went to the people that do the reimbursement, and they said, this makes sense. And we said, we'll guarantee for, 10 years or whatever. And there were all sorts of things that went into the reimbursement side. But it was really about chasing a cure for these patients and our ability to impact patients' lives. That's the only reason this industry exists, is for patients. Right. That's it.
That's right.
I mean, you can, shareholders get all worked up and, share price goes up and down. And I get it, but that's the scoreboard for me. That wasn't the game plan.
Well, I appreciate that, right? Which is you took your time, you watched the industry, how it played out. And this is curative, right? In many ways, I don't want to say you owe something to this patient population, but you did it with this patient population in mind, for sure.
Yep.
Oh, I do want to talk about that last deal, Vifor, which was in 2021, 2022 timeframe. You acquired Vifor, which was a very large acquisition, the largest ever in CSL history, $11.7 billion. And it was in the area of nephrology and iron deficiency. And so really this, on the surface was a diversification. It was going into a new underpenetrated market. I had read that it was an asset that you had watched for maybe a decade. But in the end, this deal did not play out as expected. And much of it was after you left, where generics were allowed to get onto the market much sooner than CSL had expected. And the US market was just a little bit harder. There was a lot more hurdles that needed to happen for the US market. So I said to you before in a call that we did, this will not be the first or last acquisition that doesn't go as planned. But how do you think about deals like that as you reflect on it? Maybe a couple of years out.
The way I thought about it was really the same way that I thought about the other deals, which is it was in a space that we did have some knowledge about, right? And so it was rare diseases. It was kidney dialysis centers that we were dealing with. And many of them were in the same areas as our plasma centers. And so we had an idea as to how they operated and the DRGs that were there, if we could actually add products to the portfolio that were covered under the way these patients went. But we had other things going on in kidney disease, and iron deficiency is one of those areas that, for me, is an unloved space. I mean, it's still a huge problem today. And so the iron business, and look, I'm not sure many people know about injectable iron even today, but that's the only way you're really going to get your iron levels up. You can take all the pills you want, but they're poorly absorbed. They cause a lot of GI problems, even some of the products that Vifor made. And so getting patients really diagnosed with iron deficiency and getting an iron shot is a huge thing. The amount of women that suffer from iron deficiency that are still not feeling well today. I mean, it's an amazing transformation when you see people that actually can get their iron up. You're not going to get it eating spinach, I can tell you. You'll need it. First of all, when they made that table,
Swayman spinach.
Yeah, well, they also, Popeye, they also put the decimal in the wrong place when they said the amount of iron that was in it back in the 50s, and nobody ever changed it. So there's really not a lot of iron in spinach, as people believe. But at any rate, I saw opportunities for something that was hard to do, unloved space, and I loved that. And we had some knowledge. So those are the things. I wasn't going after the shiny object at all.
No.
And it's
No.
not shiny. And, they actually start making injectable iron with iron ore. I mean, talk about hard to make. The plant that we bought with Vifor was made out of wood, mostly the framing, because the first step in getting the iron ore done is hydrochloric acid wash. So it's a very difficult process. You're actually taking metal particles and you're going to start to leach the iron out of this to actually inject in somebody's vein at the end of the process.
Yeah.
It could be explosive, the process. There's, it's corrosive, it's explosive, it's difficult to do. Not a lot of people can do it at scale. So I saw an opportunity there, but building that iron market is difficult and it takes time. And I knew it was going to take time to do that. I don't know how much time and I don't know how much effort, but the deal itself, for me, financially seemed like a good deal. And at the time, the market cap was over 100 million US. So it wasn't a bet the farm acquisition.
It was not. Okay.
But it was still a big deal for CSL, the biggest that had ever been done. And so there was a lot of scrutiny around it, and I get it. Would I do it again? I think the opportunity was still right. Maybe the price wasn't, but that's what was negotiated at the time. So I think that's where we ended up, and everybody was on board with it. And it's still generating billions in revenue, a year. But so, I think it added to the portfolio. But I didn't see it as much as a diversification as most people saw it. They said, well, you're not in that business. And I'm like, well, it's difficult. It's highly dependent on manufacturing, which we're huge operationally in manufacturing.
Yeah.
We visited the plants at Vifor and multiple times. And the people at the plants were like, what are you doing here? We've never seen anybody from the company come to our plants. We just run the plants, but the executives never come here. They don't come and visit us at the plants. I said, well, we do, because we're interested. We want to know what's going on. We need to know if we need to invest. We need to know these things. And the only way to know it is to get eyes on it and spend time with you and figure out what's going on. So, there were opportunities that I saw that I think we could improve on. And I think there were improvements made during that time period, but clearly, it didn't. The expectations of the investors in terms of the payback were not accomplished, evidently. People were not happy with the end performance.
Yeah. Well, I appreciate your honesty and frankness about it because, as you said, some things work out, some things don't. And it's possible it still may, right? It's not
That's
an
right.
asset that has been written off by any stretch. But, I like the way you frame it, which is this was in your wheelhouse in many ways. So these were capabilities, and you're willing to take on a challenge because it was similar to something that you had done before.
Flu was a challenge too. I mean, it was a tough business at the time, but again, we had some knowledge, and again, that's where I tried to differentiate. We were not serial acquirers.
No.
In 10 years, you talk about 3 deals. I mean,
right.
There's companies today that did 3 deals last month. It's like, it's not like we were out there, constantly acquiring to grow. We were growing because we had the benefit of that core business in plasma, growing at double digits every year, double-digit growth on the core of the business, which allowed us then to start to expand into these other areas with thoughtfulness and purpose, right, and insight. That's the way I looked at the business.
There you go. I want to talk about COVID. And I will say many of our listeners would sit here and say, why do I need to talk about COVID? It's a once in a, lifetime sort of thing. But the COVID pandemic was something that really affected CSL in a major way, good and bad, right? We
Mhm.
just talked about the flu business, right? So you had the opportunity to develop flu and with AstraZeneca and provide flu vaccine to, Australia and perhaps other countries. I'm not sure. But
COVID
then your
vaccine.
COVID vaccine, right? Sorry, I'm sorry. Did I say flu vaccine? My mistake. COVID vaccine. But then on the other side of the house, your plasma business really took a backseat and suffered because you couldn't collect, right? And get people in. So how did you manage during that period of time when you've got very disparate factors affecting your business?
Yeah, look, it was a struggle, I would say, to manage during that time because you had everybody pulling and pushing on you, from regulators, governments, because everybody can lament and look back on the COVID vaccine and say, oh, this, that, the other thing, but everybody wanted it.
Of course.
All you heard was screaming, when are you going to get a vaccine? When are you going to get a vaccine? Then when they got it and gave it to a couple of billion people and ended up surprisingly that some people get side effects from these things because they're things you're putting into your body, which happens with pretty much everything, including food and other things. These the When that happened, and everybody was rushing to get the product development wasn't rushed the way people think. We did it faster than we normally do it because there was funding to help do it, where before you have to allocate these things, right? So people don't really understand kind of the process we went through and warp speed. And I went to the White House. We were also trying to do antibodies with IVIG, get plasma from people that had recovered from COVID, that had high titer antibodies. There's a trial that I got and my head of R&D specifically got 3 of our competitors together to collect that amount of plasma because people didn't want to come back into the hospital after they recovered from COVID and give,
Right.
plasma. So we had to do it. And the NIH ended up running the study, but unfortunately it didn't pan out because the antibodies had come out as well. And you really needed naive patients who hadn't developed full-blown COVID that still had the functioning immune system for these things to work. So it was another thing besides the vaccine. There was a lot going on, a lot of requests from governments to do things outside of our normal course. The plasma side was difficult, obviously, because people weren't out, right? They were locked up. And when they came to a plasma center, which we kept open, at the very beginning, we had people in full astronaut
PPE.
suits.
Right.
That's not the most welcoming sign to say, come on in.
Right.
It's more
Exactly.
like maybe I should stay out of here.
Yeah.
And we had to take beds out and separate the beds and the 6 feet and the this and the that and all the things that went into it. And so it's a very difficult time to say, okay, are we getting enough plasma? Are the patients able to get to the hospital and get their IVIG and the albumin? And, there were all the things that you went through in terms of trying to understand how long was it going to be? Nobody knew. How long is it going to take for us to recover from these things? And what do we have in our back pocket or in our wallets to be able to afford all the things we're doing today? Um, we had a lot of people going to work every single day during COVID. We didn't have the shutdown of small businesses. Our plasma centers were open. The scientists aren't allowed to take all the equipment home and put it in their garage and do their work for
Right.
R&D. So they
Yeah.
had to come in, right? The manufacturing people can't do it out of their garage. So they had to come to the plants. And those people were frontline there every single day. They were amazing.
Yeah.
While I'm sitting in my office here, trying to run the company because I couldn't even get into Australia, right? So, I mean, I could, but then I'd have to quarantine for 2 weeks and then quarantine again before I left. I'm like, so I'm going to go over there, fly 24 hours, be locked up for 3 weeks, And then what am I going to do? I can't go to the office, so that means I'm going to go in the plants. I can't really help those people
Right.
because I'm not touching the machines. They don't want me touching any of that stuff. So it was really I felt a bit helpless from time to time, to be
Yeah.
honest.
Yeah.
That maybe there was more I could do. But we had such great people managing that process and making the vaccine, the AstraZeneca's vaccine. We had another vaccine we were trying to manufacture that didn't see the light of day, unfortunately, because of one slight aberration in the linker. But these are the things that you have to step up. You have to make sure you're available, but you have to trust your people. You're not going to be able to control all of that. Work from home is different than, just staying home. They have to understand. And it's hard to work from home. I mean, even as a sales rep at the very beginning, Bev would say, hey, you coming home early today? I said, why? She goes, it's Friday. I said, yeah, it's a work day. It's not coming home early.
Right. Yeah, time is money,
Yeah,
especially as
for
a
sure.
salesperson, right? Well, thank you for that. Like I said, COVID, I think, very often, as I said, listeners will probably say, why do I need to learn about COVID again? But that is when leaders are tested the most.
It is. You're managing through a complexity that no one's ever seen. And these things come up in small bits every day. COVID was the mass example. But when you're reviewing all the R&D portfolio projects, twice a year with the head of R&D and their teams, and you see something, that's and you hear something and you have to make decisions that could affect their whole project in a bad way because it's not going to see the light of day, but they still are believers. I mean, those are hard decisions to make because people spent a couple of years on these things and now you're going to kill them.
Yeah.
Which people are also in pharma are afraid to do is kill projects, which, you need to at some level. So anyway, it's one of those things. There's little examples every day of dealing with people, dealing with situations, whether it's HR situations and people, whether it's, workforce, deployment issues, whether it's any of this. COVID was just layered on top of that, but it gave you that macro view of, okay, how can I sustain my mental health, my physical health, my business health, my family health, to make sure that all of this continues because, somehow they put me in charge. So,
Right.
I'm trying to do all that.
Yeah.
So.
Well, Paul, I can't thank you enough for your time. Thank you for answering some not so easy questions. And thank you for giving some insights on your career and the advice that you give to others. So keep up the good work. Thank you.